Hey everyone, it's Jacqueline here. I'm just going to demonstrate my postpartum assessment. So I first start off by introducing myself as Jacqueline, a student, nurse, the client. I pull the curtains for privacy, and then I wash my hands. I check the client for 2 IDs, make sure it's the correct client. I'm going to raise the bed up to waist height, and I'm just going to inform them that I'm just going to be doing a postpartum assessment, making sure everything appears normal. I'm going to be doing safety checks, making sure everything seems to be working that she needs. I'm going to be checking her vitals and make sure everything's within normal range, and I'm going to be doing an overall pain assessment using PQRST. And then I'm going to start off with a breast examination. I'm going to be assessing her nipples, and when I'm assessing her nipples, I want to see if they're inverted, the color, if they're swollen, if they're intact, if there's any cracks, if there's discharge to them. And I'm also going to be palpating her entire breast. I'm going to be asking if there's any tenderness or if there's any pain at all as I'm doing this. I'm going to be feeling for any lumps or bumps, and there doesn't seem to be anything. Now I'm just going to ask if she has any questions or concerns with breastfeeding. If she is able to breastfeed, we definitely encourage her to breastfeed. And now I'm going to be moving on to assessing her fundus. And as I'm palpating it, I want it to be firm. Now if it's not, it can be bodgy. So what I'm going to be doing is doing a fundus massage. And I'm just going to inform her that this can be uncomfortable, a little bit painful, so I'm going to try and distract her by asking her about her newborn. For performing this, you're going to be cupping your lower hand just above the pubic symphysis, and the top hand is going to be massaging the uterus on the top in circular motions, and this will make the uterus turn firm. And then afterwards, I'm just going to reassess it and make sure that it is firm, and it is. And now I'm going to move down onto her perineal area, and I'm going to be assessing her vagina and see if there's any bleeding, swelling, redness, with regards to asking her about pain. If there's stitches in there, I see if they're still intact, and everything is healing as it should. And then I'm going to be assessing her pad, so looking at lochia and assessing the amount of fluid, the color of it, if there's blood clots, if the smell of it. So I'm going to be assessing overall the perineal area for signs of infection. And then I'm going to ask her about voiding, if she has been able to void, and how frequently and how much, and if it's painful when she does urinate, and the color of it. And if she isn't peeing a large amount, we want her to be peeing 30 milliliters every hour. And if she's not, we're going to encourage her to drink more. And I'm just going to get her to roll over and look over there so I can assess her back side. So I'm going to be assessing the back side of the pad once again for the amount, the color, blood clots, the smell of it, and then I'm going to assess her anus, see if there's any signs of hemorrhoids. And since I have her on her back head, I assess her back skin, make sure that's intact and there's no redness or anything wrong. And I'm going to ask her about bowel movements, if she has been able to have a bowel movement, how much, what is the consistency of it, is she passing gas, and if there's any pain with that. I'm going to get her to roll back onto her back, and we're going to want to encourage her to be eating and to get moving as soon as possible. One thing I want to check for is deep vein thrombus, so get her to do a dorsal reflex, and the back of her knee, behind her knee, she will feel pain. And I want to check for calf tenderness or swelling, and I want to check for edema in all the extremities and on her face as well. So I just want to encourage her to drink lots of fluids, to get eating, to have fibrous foods because she doesn't want to get constipated, get moving. I want to ask her about her bonding with her child. So I want to see how she is mentally, spiritually, physically, what her support system is like, and just support her through this transition in her life and answer any questions that she has. All right, thanks everyone.